Drug abuse has become an increasingly significant and tragic problem in our modern society. Today we're going to dive into the biological mechanism of specific drugs and of addiction. So let's get started. Although society commonly stigmatizes drug addiction to be simply a matter of lack of motivation and carelessness, drug addiction is a chronic brain disorder that is fueled physiologically, meaning it is caused not only by one's choice, but by the molecular mechanisms in the brain. What fuels drug addiction? First on the list is drug tolerance. We must first consider what happens as someone uses a drug repeatedly. The more the person consumes the drug or addictive substance, the more their body requires of it to reach the same effect. Ergo, they become more tolerant as well as more dependent on the drug. Second is withdrawal, which describes the unpleasant and even possibly life-threatening symptoms that occur when the addictive substance is no longer present in the body. Withdrawal symptoms range from moderate headaches to muscle pain to even tremors and seizures, making it extremely difficult for those who want to quit to actually relinquish their drug use. Genes can also play a factor. Genes can affect how the brain circuits respond to drugs or how quickly drugs enter and leave the body, and scientists have found that even as much as 50% of addiction can be attributed to genetics. Now, of course, one of the most significant aspects contributing to drug addiction is the euphoria and pleasurable feelings that accompany most drugs and addictive substances. Drugs produce a sense of pleasure by activating the reward pathway in the brain and releasing or mimicking dopamine, the neurotransmitter or chemical messenger in the brain that stimulates and circulates the reward pathway. When our body learns that the addictive substance produces a feeling of reward, the brain wants to repeat that action to produce the favorable feeling again, increasing the chance that the user is taking the addictive substance. Now let's go to the molecular level. Drugs work most commonly by acting as either agonists or antagonists for existing neurotransmitters. Agonists copy or mimic the actions of certain neurotransmitters, such as binding and activating the neurotransmitter's receptor pathway. Antagonists, on the other hand, block the action of the neurotransmitter, possibly by blocking the receptor from receiving the right neurotransmitter. Let's consider a specific category of drugs, opioids, which are commonly known as painkillers. Our body produces natural opioids called endorphins, which are neurotransmitters that control our motivation, emotion, and most significantly, our response to pain. When endorphins bind to opioid receptors, they produce analgesia, meaning they reduce the sense of pain that we feel. Synthetic opioids used to treat pain act as agonists to endorphins, binding to the opioid receptors to produce a sense of pain relief. However, many illegal versions of these opioids are sold on the black market, and they can be extremely dangerous. When taken in excess, these opioids can cause one to stop breathing. In the past 2 decades, the number of overdose deaths involving opioids has quadrupled, and currently about 100 Americans die from opioid overdoses every day. Unfortunately, about 80% of current heroin users began their opioid use from prescription pain medications. Heroin is an illegal opioid that takes about 15 to 20 seconds to reach the brain, after which it is converted into morphine, binding to opioid receptors and triggering the reward pathway to release dopamine. The devastating effects of heroin beg the question, how can we treat opioid addiction? Currently, naloxone is used as a treatment for opioid addiction and overdose. Naloxone blocks opioid receptors and thus prevents opioids from binding, acting as an antagonist to opioids. If naloxone is given to an OD patient fast enough, the OD may be reversed. Naloxone is used in opioid addiction prevention as well as an OD treatment. Methadone and buprenorphine are also other drugs used to treat opioid addiction that do so by stimulating opioid receptors, but producing a limited high and reduced withdrawal symptoms. Buprenorphine is in fact safer than methadone because it has a weaker effect. In addition to these drugs, cognitive behavioral therapy has also been found to be effective for opioid addiction when combined with drug treatment. Now we'll discuss another highly addictive substance, nicotine, which is found in cigarettes, cigars, tobacco products, and jewels. Nicotine takes about 10 seconds to get to the brain, after which it binds to the nicotinic acetylcholine receptors. Nicotine releases adrenaline, which in turn raises blood pressure and quickens heart rate, as well as other effects. Nicotine also stimulates the release of dopamine, which, as we've previously learned, creates a sense of pleasure and calmness, and can also create a rapid boost in attention. Tobacco products are the leading cause of preventable deaths in the U.S., causing about 90% of lung cancer deaths, 60% of lung disease deaths, and 30% of heart disease deaths. Nicotine is not the primary substance causing cancer in these tobacco products, but it does increase the risk for heart disease and stroke. And nicotine is also extremely addictive, so even the few smokers that attempt to quit actually manage to successfully do so. So then, how can nicotine addiction be treated? Nicotine replacement products like nicotine patches can be used to relieve withdrawal symptoms and slowly allow the person to lay off their nicotine addiction. Additionally, buprenorphine also can treat smokers by stimulating nicotine's effect on dopamine. If you remember from previous slides, buprenorphine is also used to treat opioid addiction for the same reason. However, in terms of drugs, varenicline is the best single drug option for nicotine addiction, stimulating the nicotinic acetylcholine receptors that are most responsible for the nicotine's addictive properties. For our next addictive substance, let's look at alcohol. The main addictive component in alcohol is ethanol, which is soluble in water, meaning that it can easily enter the bloodstream and travel to the brain. When ethanol is ingested at low levels, it acts as a stimulant, but when it's ingested at higher levels, it acts as a depressant, which means that it can cause sleepiness, potential blackouts, and short-term memory loss. Ethanol targets the GABA receptors in the brain, which, if you remember from previous videos, are the major inhibitory receptors in the brain. Ethanol binding to GABA receptors will have inhibitory effects like the weakening of muscles and a decreased anxiety. Basically, inhibitory effects means the body is slowing down. Ethanol also blocks NMDA glutamate receptors, which are responsible for encoding our memory. This explains why getting drunk or ingesting large amounts of ethanol can impair your memory, because it's basically not allowing the glutamate memory pathways to work properly. Ethanol is also a diuretic, meaning that it dehydrates your body by pulling water from your body tissues. When ingested in large amounts, ethanol can also cause your heart rate to slow down and can cause breathing difficulties that can become severe. When one drinks the alcohol excessively and repeatedly, they can develop an addiction and form alcohol use disorder, which is extremely damaging to the body. First, you're probably familiar with alcohol's connection to the liver. Alcohol addiction can cause cirrhosis or scarring of the liver. Alcohol addiction can also damage the cerebellum, a part of the brain responsible for movement and balance of the body, leading to an unsteady gait as well as tremors and slurred speech. Now we'll talk about marijuana, which comes from the cannabis plant. Marijuana has two major components, THC and CBD. THC distorts one's perception and can also alter a person's sense of time and self. Our body actually has a normal form of THC called anandamide, and anandamide binds to cannabinoid receptors in the brain that coordinate movement. So, when THC in marijuana binds to these receptors instead, the normal functioning of these cannabinoid receptor pathways is impaired, and we can see this with marijuana's impairment on driving. The hippocampus also has THC receptors, explaining why marijuana can also contribute to short-term memory loss, since the memories formed while the person is under the influence cannot be properly encoded while THC is taking up all the space in those receptors. Now let's talk about the second component, which is CBD. CBD does not produce a high, but it can actually control epileptic seizures, relieve pain and inflammation, and treat the nausea side effects of chemotherapy. However, the positive effects of CBD definitely don't mean that marijuana is a beneficial drug. On the contrary, it can cause long-term memory, learning, and thinking deficits, as well as the inability to think clearly and increased risky behaviors. Long-term marijuana use has also been linked to schizophrenia, a psychotic disorder that often causes paranoia, hallucinations, and cognitive impairments.